Polycoria, a rare eye condition with multiple pupils. Polycoria is an eye condition that affects the pupils, the openings in the center of the iris that control how much light enters the eye. Normally, each eye has one pupil that constricts in bright light and dilates in dim light. However, in polycoria, there are two or more pupils in one eye, each with its own ring of muscle that regulates the light intake. This can cause vision problems and complications. Types of polycoria. There are two main types of polycoria: true polycoria and false polycoria. The difference between them is whether the additional pupils are functional or not. True polycoria. This is a very rare condition where each pupil reacts to light independently by constricting or dilating on its own. True polycoria can affect one or both eyes, and it can be present from birth or develop later in life. It can also be associated with other eye conditions, such as detached retina, polar cataracts, glaucoma, or abnormal development of the pupil or the iris. False polycoria. This is a more common condition where the eye appears to have multiple pupils, but only one of them is functional. The other holes in the iris are just effects that do not affect the light intake. False polycoria can be caused by trauma, surgery, inflammation, or congenital anomalies of the iris. Symptoms of polycoria. The main symptom of polycoria is the appearance of two or more pupils in one eye. Other symptoms may include blurred vision in the affected eye, poor, dim, or double vision in the affected eye, oblong shape of one or all additional pupils, issues with glare or light sensitivity. Diagnosis of polycoria. Polycoria can be diagnosed by an eye doctor using a slit lamp examination, which is a device that magnifies the eye and allows the doctor to see the details of the iris and the pupil. The doctor may also use other tests, such as pupillometry, which measures the size and reaction of the pupils, gonioscopy, which examines the angle between the iris and the cornea, ultrasound biomicroscopy, which uses sound waves to create images of the eye structures. Treatment options for polycoria. Some people with polycoria do not need any treatment if their vision is not affected. For those who have vision difficulties, surgery may be an option. The surgery is called pupilloplasty, and it involves cutting through the iris tissue and removing the bridge between the pupils. The surgery may improve the vision and reduce the glare. However, the surgery is not widely available and may have risks and complications. Outlook for polycoria. Polycoria is a rare and complex eye condition that can affect the quality of life of the affected individuals. However, with proper diagnosis and treatment, some cases of polycoria can be managed and improved. If you have any concerns about your eyes or vision, you should consult your eye doctor as soon as possible